Nitrate tolerance. It is a major problem with the use of nitrates as chronic anti-anginal therapy. Nitrate tolerance is associated with loss of nitrate effects and after long-term use causes abolition of the hemodynamic and anti-anginal effects. History of nitrate tolerance. Nitrate tolerance was first observed among explosive workers exposed to nitroglycerin. The story began when these workers developed severe headache and dizziness after the initial nitrate exposure. Through working days in an explosive production factory, these side effects diminished. Later, on weekends, these workers were off from work, and there was no nitrate exposure. The following Monday, upon re-exposure to nitrate, all symptoms returned. Weekday symptoms reduction despite ongoing exposure resulted from developing nitrate tolerance. Mechanisms of nitrate tolerance. Mechanism is incompletely understood. Studies showed that the tolerance mechanism is most likely due to attenuation of the vascular effect of nitrates, and it could not be related to changes in pharmacokinetics of this medicine. 3 hypotheses have been proposed to explain the mechanisms of nitrate tolerance development. Number 1. Nitrates are converted to nitric oxide, an active agent, by mitochondrial aldehyde dehydrogenase enzyme within vascular smooth muscle cells, leading to the vasodilator effect of nitrates. Chronic administration of nitrates produces a state of oxidative stress leading to dysfunction of mitochondrial aldehyde dehydrogenase enzyme. Consequentially, the dysfunctional enzyme is unable to produce active nitric oxide and the angina-relieving effect of nitrate agents is reduced or lost. Other hypotheses for the mechanisms of nitrate tolerance include reduced bioactivity of nitric oxide, an active agent, activation of the vasoconstrictor renin-angiotensin-aldosterone system, and sympathetic nervous systems in response to nitrate-induced vasodilation. Prevention of nitrate tolerance. Several strategies have been attempted to prevent nitrate tolerance. Number 1. Intermittent nitrate therapy. It is considered as a most effective preventive strategy. An intermittent nitrate therapy provides an adequate 8 to 10 hours nitrate-free interval. A nitrate-free interval permits the regeneration of reduced sulfhydryl groups, thereby restoring vascular responsiveness to nitrates, and maintain anti-anginal efficacy with the use of chronic nitrates. Intermittent nitrate therapy does not provide a full 24 hours anti-ischemic coverage, and placing patients at risk for angina episodes. Therefore, clinicians and clinical pharmacists should be vigilant about 2 key concerns associated with intermittent nitrate therapy. Number 1. A time zero effect, which is time without nitrate. Number 2. Rebound angina. A time zero effect refers to a deterioration in exercise performance relative to placebo prior to the morning dose of nitrates, and rebound angina refers to an increase in angina during the nitrate-free interval. To mitigate key concerns related to intermittent nitrate therapy, the clinical pharmacist assists clinicians in determining the optimal timing of the nitrate-free interval and selecting appropriate nitrate preparations. Optimal timing of the nitrate-free interval. A clinical pharmacist recommends for a day nitrate-free interval and a nighttime nitrate-free interval. Nighttime nitrate-free interval provides a break from nitrate medication during the nighttime hours when the patient is sleeping. Most patients have lower myocardial volume oxygen at this time. Despite these benefits, the clinical pharmacist addresses key challenges associated with the nighttime nitrate-free interval. Considering that during nighttime free interval regimen patients are free from nitrate during nighttime sleep, another side it is well documented that angina episodes and myocardial infarction commonly occur in the morning hours, immediately before and after awaking. Therefore, this regimen would not provide a protection to the 20% to 30% of patients with stable ischemic heart disease who experience nocturnal episodes of angina. Here are the clinical pharmacist's recommendations to ensure safe use of the nighttime nitrate-free interval regimen. 1. Do not prescribe nitrate as a monotherapy in patients with stable ischemic heart disease. 2. Consider the addition of beta blockers or calcium channel blockers such as diltiazem to the nitrate therapy regimen. These recommendations aim to minimize the lack of 24-hour coverage, the lack of protection against circadian-related ischemic events, and the potential for reflex tachycardia. Day nitrate-free interval is the other recommended optimal timing of the nitrate-free interval regimen. Several trials examined the use of chronic nitrates with a daily nitrate-free interval. These trials demonstrated increased exercise time, reduced exercise-induced ischemic events, and reduced need for sublingual nitroglycerin. Another strategy for mitigating key concerns related to intermittent nitrate therapy is to select appropriate nitrate preparations. Selecting appropriate nitrate preparations. There are different nitrate preparations used for long-term prevention of angina episodes. Most commonly prescribed chronic nitrates are isorbide mononitrate, isorbide dinitrate, and transdermal nitrate. We should schedule the appropriate timing of these nitrate preparations to maintain an anti-anginal effect, an adequate nitrate-free interval, and patient adherence. Let's review ISMN preparations and related appropriate nitrate-free interval regimens. There are two ISMN preparations. Number 1. The extended-release ISMN preparation dosed once daily, and number 2. The immediate-release ISMN preparation dosed twice daily. The nitrate-free interval of the extended-release ISMN preparation, which is dosed once daily, means the patient can take the medication at 8 a.m. in the morning, providing 12 hours of nitrate exposure followed by a 12-hour nitrate-free interval. The immediate-release ISMN preparation is dosed twice daily. The patient can take the medication at 8 a.m. and 3 p.m. Considering that the duration of action of immediate-release ISMN is equal to or more than 6 hours, this dosing timing provides at least 7 hours apart from first dose to maintain anti-anginal effect and provide an adequate nitrate-free interval after second dose. These dosing schedule for both ISMN formulations ensures effective anti-anginal coverage and an adequate nitrate-free interval while incorporating better patient adherence. ISDN is typically dosed 3 times daily, with intervals of 4 to 5 hours between doses, for example, 8 a.m., 1 p.m., and 6 p.m., to ensure effective nitrate exposure while maintaining an adequate nitrate-free interval, typically overnight. Although ISDN is an effective anti-anginal drug, its 3 times daily dosing complicates maintaining optimal nitrate exposure and a nitrate-free interval, thereby compromising patient adherence. Complementary tips to consider. The addition of a beta blocker, such as metoprolol, provides continuous patient protection, even during the nitrate-free interval. Patients who use long-acting nitrate will still respond favorably to sublingual nitroglycerin in case of an anginal attack. No evidence indicates that use of long-acting nitrates leads to resistance or tolerance to the effects of sublingual nitroglycerin. Adjust timing of nitrate administration for patients who work evening or night shifts to coincide with when they are active during the day. Beside the intermittent nitrate therapy, which is first and most important preventive strategy, several other methods have been proposed to reduce nitrate tolerance. These methods include the addition of folic acid, L-arginine, hydralazine, and antioxidants such as vitamin E and vitamin C. A few studies suggest these preventive strategies may be helpful. However, none have yet been used clinically. Thanks for watching. If you found this helpful, hit the like button and please subscribe to get future video lessons.